This is the second part of our spirochete lecture. And in this lecture, we're going to focus on the organism Borrelia. And there are two different species of Borrelia we're going to discuss. One is Borrelia recurrentis, and the other is Borrelia burgdorferi. So here is an electron micrograph of Borrelia recurrentis, and you can see that spiral shape to the organism, hence its categorization as a spirochete. Here is Borrelia burgdorferi. On the right, you can see the dark field microscopy. So the background is dark and the organism is light. So we're going to talk about the clinical manifestations first. One of the species of Borrelia is Borrelia recurrentis, and this organism causes the disease relapsing fever. So this is also called louse-borne epidemic relapsing fever, and transmission occurs when infected lice, the plural of a louse, are crushed and then scratched into the skin. There's also a tick-borne endemic relapsing fever that is also Borrelia recurrentis, and transmission of the tick-borne relapsing fever is through the saliva when the tick is taking a blood meal. So these are more similar in their transmission to the rickettsia infections. However, they are spiral organisms, so they're spirochetes. So just know that Borrelia recurrentis causes relapsing fever, and there are two different types of transmission. One is through the louse and another is through a tick. Now, the incubation period is between 2 and 15 days. Infected individuals usually get a fever, chills, severe headache, muscle pains, and weakness. Now, this flu-like symptom period lasts between 3 and 7 days. Then they get a period that can last days to weeks where they don't have any symptoms, no fever, might feel a little weak, might feel a little tired, but they don't really have any major symptoms. Then, days to weeks after the initial symptoms, they get a recurrence. So what happens with Borrelia recurrentis is it's able to undergo antigenic variation. So an individual is infected with Borrelia recurrentis, and within a few days, a week or so, will start to get symptoms. The individual's immune system will come in and start to make antibodies against the Borrelia recurrentis and start to fight the infection. Well, what happens is Borrelia recurrentis realizes it's starting to get killed off by the host immune system, so it changes the antigens on the surface of the organism so that the host immune system can't recognize it any longer. So it will seem like you fought off the infection for days or weeks, and then all of a sudden, when the organism changes its antigens, you no longer recognize it anymore, and the organism starts to grow and attack again, and you get symptoms again. So this type of relapsing fever, where you have a febrile period and then an afebrile period and then a febrile period and then an afebrile period, repeats itself more frequently in the tick-borne form of Borrelia recurrentis. So here is one of the tick vectors that can transmit Borrelia recurrentis. Now, our other species of Borrelia is Borrelia burgdorferi. This organism is probably a lot better known, especially in the United States, because this is the causative agent for Lyme disease or Lyme borreliosis. So Lyme disease is a zoonotic infection that's associated with small rodents and deers, and it's transmitted through the Ixodes species of ticks. And there are 3 stages of Lyme disease. There's a primary stage, and in this stage, individuals, not all individuals, but a majority of individuals will get what's called Erythema chronicum migrans, or ECM. And what Erythema chronicum migrans is it's a rash at the site of infection. So an individual will be walking through the woods, will get a tick on them, an Ixodes tick that happens to be infected with Borrelia burdorferi. The tick actually has to be taking a blood meal on an individual for several days before it will actually transmit the organism. However, once the organism gets into the body, individuals usually will develop this bullseye target rash that is called the Erythema chronicum migrans, and that's the primary stage of infection. However, not everyone gets this rash, and some people do get the rash, but it's in a location that they never see. So some people just have no indication that they even had a tick on them and were infected. So for example, if you had a tick on your scalp and you have the bullseye target underneath your hair and you don't see it at all, or maybe you have it on your back and you don't normally look in the mirror at your back, and maybe you live alone, so no one ever sees and you don't see that you actually have been infected with Borrelia burdorferi. So that primary stage can easily move in to the next stage, which is the systemic stage. And in this stage, individuals might get secondary skin lesions. They usually will get a migratory joint and bone pain. You kind of feel like, oh, wow, I kind of lifted a box yesterday. I'm feeling a little achy. And you don't really pinpoint it to anything in particular. I do know several people that have Lyme disease, and these are some of the things that they have talked about, just kind of having this achy feeling that moved around their body, and they never really pinpointed it to Lyme disease. They just kept thinking they were overexerting themselves. Also, some individuals will start to get neurologic and cardiac pathologies, and most individuals do say that they are very, very tired. They just feel very achy and tired and can't quite figure out what's wrong. So from that systemic stage, if the Lyme disease is not diagnosed, it can go into a chronic late stage. So in this chronic late stage, individuals commonly develop arthritis. So this arthritis can occur either weeks or years after the initial infection. Usually also in the chronic late stage, people will get persistent heart symptoms, musculoskeletal problems, and neurologic symptoms. So again, signs and symptoms, usually it's going to begin as a lesion at the site of that tick bite, that little tiny bullseye rash that's going to expand. It's going to start to spread out. And as long as you can see that rash, you might have a clue that you've been infected with Borrelia. Usually individuals will feel achy, tired, have a headache. They might have a fever, chills, stiff neck, bone pain, muscle pain, and they can develop meningitis, encephalitis, and carditis. Now, arthritis usually is going to be the later chronic stage of the infection, and rarely is Lyme disease fatal, but there have been more recently as more and more is known about Lyme disease, because Lyme disease is it's considered a newer infection. As more people know about it and as it gets diagnosed more readily, there have been fatalities from Lyme disease due to these the chronic stage and the heart involvement and neurologic involvement. So if you see on this picture in the Lyme disease facts and challenge, the little dot on this person's thumb in that top picture on the left is the actual size of an adult Ixodes deer tick. So what happens is deer will have Borrelia burgdorferi. Ticks will feed on mice and deer, both that have Borrelia burgdorferi. The ticks will get the Borrelia burgdorferi. Then the ticks will get into humans, usually accidentally. And the ticks are so tiny, you never even see them. They look like a teeny tiny freckle. And if you may not even notice it. And you don't normally feel ticks taking a blood meal. It's not like an insect bite where you're going to feel any sting or anything. They can stay on you for days and days and days, feeding away, and you never know it. So the middle picture is a actual spirochetes of Borrelia burgdorferi, that nice spiral shape, and the bottom is the bullseye Erythema chronicum migrans. And this right picture is a very magnified picture of an Ixodes tick on an individual. So again, the actual size of the tick before a blood meal and after a blood meal. So they get a little bigger after a blood meal. Maybe you might notice them a little more, but they are still very tiny. Here is the typical Erythema chronicum migrans, and at the site of the infection, you might see a darker red area surrounded by a clear area surrounded by a red, pink area. This is actually my best friend's little girl who they were visiting relatives in Connecticut, and not in Lyme, Connecticut, but in Connecticut nonetheless. And the little girl was just walking around in the backyard. They didn't go on a hike, they weren't in woods or anything. But she ended up getting a typical Erythema chronicum migrans, and they treated her for Lyme disease right away. Now, her mom, my best friend, is a medical technologist, just like you all are going to be, and just like I am. So she immediately knew that this rash meant possible Lyme disease and took her in right away. So she has no problems now. Now, the habitat of Borrelia burgdorferi, it's maintained in animals. Ticks then pick up the organism, and humans are accidentally infected. With Borrelia recurrentis, you have the humans as the reservoir of the louse-borne form, and animals as the reservoir for the tick-borne form, where humans get accidentally infected. Now, transmission, these are insect-borne diseases through ticks and your lice, and prevention is to avoid contact or prevent being infected or contact with ticks and lice. So this is from 2006, but this is the number of reported cases by county in the United States. So the very dark blue areas are greater than 15. More recently, more and more people are getting diagnosed with Lyme disease. Years ago, when it was first identified, a lot of physicians just, people came in, oh, I'm having bone joint pain, depending on what age they were. Oh, okay, here's some anti-inflammatories, you have a little arthritis. Now, people come in with specific symptoms, and Lyme disease is a test that's ruled out. So I was a med tech in Connecticut, and I worked in a hematology lab for 2 years. And in that lab, we did all of the serology. So we did all of the ELISA tests. And in the summer, we would have hundreds of Lyme disease tests to do. So the ELISA tests are done in a 96 well plate, and sometimes in the summer we'd have 6, 8, 96 well plates filled with patient samples for Lyme disease, and many were positive. So the best way to prevent Lyme disease or any type of tick-borne infection is if you are going into a wooded area, going on a hike, going for a long walk, taking your dog for a walk in the woods. Wear protection. Even if it's a hot day, they always say wear long sleeve shirts, wear long sleeve pants, make sure they're light in color, so if you pick up a tick, you'd be more apt to see it. Tuck your pants into socks so that the ticks can't crawl right up your pant legs. They tend to do that. Wear closed-toed shoes, wear a hat so that the ticks would be less likely to get into your scalp. I used to go hiking in Connecticut all the time with my dogs, and one time I was washing my hair. It was like, next few days after I had gone hiking in the woods, and there was a big, huge dog tick. This was a soft tick, not an Ixodes tick, which is a hard tick, that was completely engorged with blood in my scalp. So they do like to go into areas where they can hide out. Now, treatment, Borrelia recurrentis is susceptible to many different types of antibiotics. Tetracyclines are the most common because they reduce the relapse rate. There is something called Jarisch-Herxheimer reaction, and this happens when people who are treated with antimicrobials then experience chills, fever, headache, and it's thought to be caused by the endotoxin release as the Borrelia recurrentis are being killed by antimicrobials. Borrelia burgdorferi can be treated with doxycycline and amoxicillin. And for late stage infections, those chronic infections, people have to be on prolonged ceftriaxone. Most diagnoses of spirochetes are done through serological based tests because these organisms are not easy to grow and require specialized media and 1 to 2 weeks to culture. So serological based tests are done, such as immunofluorescent antibody staining and ELISA, immunolinked immunosorbent assays. So what you're looking for with your serological based tests, especially your ELISA, is the IgM antibodies that are going to begin in the first 10 days after an individual is infected. The IgM antibodies will peak in about 3 to 6 weeks after people start getting symptoms. Now, IgG antibodies will peak 4 to 6 months after symptom onset. So it's very important to know when if someone was just infected, like my best friend's little girl, Sophia. The minute she saw that little bullseye rash, which was barely a week after she came back from Connecticut, Sophia didn't have any antibodies yet. So she actually tested negative, but even the physician said she likely just has not developed antibodies yet, aside from the fact she was only 2 years old, so she didn't have a very developed immune system. So you really need to know when someone might have been infected, and sometimes they haven't developed antibodies yet, or if they haven't developed IgG antibodies yet because they're still in an earlier phase of infection, you really need to look for those IgM antibodies. Now, microscopically, you can see the organism. You can do Giemsa or Wright staining of blood smears during a febrile period where an individual would likely have spirochetemia or spirochetes in the blood, and you can actually see these spiral organisms directly in a blood smear. Or you can do dark field microscopy. So we already said you can culture Borrelia, like you can culture Leptospira. There is a special media to use, and it's called Kelly media, but this is not a media that you would use in a typical clinical diagnostic laboratory. So serological testing is going to be done. You can grow the organism in animals. The Borrelia is a microaerophilic organism. It does like lower temperatures, just like Leptospira likes. It tends to prefer 30 to 35 degrees and has very complex growth requirements, so it does require the special media. So here is Borrelia burgdorferi in dark field microscope. And here it is in a blood smear, and I said you can see the organism in a blood smear, and you can see the nice spiral shape right alongside those red blood cells. And we're going to move on to the last part of the spirochete lecture.